The federal government has announced it is denying Toronto's request to decriminalize illegal drugs. Today, Premier Doug Ford pushing for even more. He wants the province to have full control of where and when safe injection sites can operate in Ontario.
Letting people do cocaine and crack and heroin, you got to be kidding me. I will fight this tooth and nail. Sometimes I wonder where people's brains are. I really do. It's unbelievable.
The Premier is reiterating his disdain in a new letter to the Prime Minister, this time taking it a step further and calling on the federal government to immediately stop approving new safe supply sites, which are currently approved solely and unilaterally by Health Canada. Doug Ford writes, in Ontario, due to Health Canada's siloed approval process, the province is completely in the dark about where these federally approved sites are operating and the quantity of controlled and illegal substances they dispense. He adds, this is frankly unacceptable given its adverse effects on our communities. It is the second letter in as many days, making clear the Ford government's stance on Toronto's proposal to decriminalize illegal drugs. Ontario's Health Minister and Solicitor General writing to Toronto's Medical Officer of Health on Thursday.
We don't want more drugs in our parks. We don't want more drugs in our streets. We don't want to see our way of life, our inherent way of life to live safely in our communities jeopardized, and we're not.
Toronto Public Health made the request to Health Canada roughly 2 years ago. The Prime Minister has now made it clear that it won't happen without the province's approval. But the city's top doctor arguing decriminalization and safe injection sites provide those living with addiction a safer alternative.
There are hundreds of people who are dying preventable deaths in our city related to drug toxicity.
Substance use is a health issue, not a criminal issue. We've always had that stance.
Mayor Olivia Chow penning a letter to Trudeau and Ford Friday afternoon, quoting stark numbers, including 500 drug-related deaths in Toronto in 2022, calling it an extraordinary loss of life of people in their prime, which is largely preventable, and requesting more resources to fund treatment programs, claiming current admission wait times can be as long as a year.
To pilot treatment programs so we can save lives.
In their decision, the federal government says that the request to decriminalize illegal drugs does not adequately protect public health and maintain public safety. They add this includes concerns with feasibility and ability for law enforcement to implement the proposed model. For City News, I'm Tina Yazdani.